Okay, so now I want to talk a little bit about some assisted reproductive technology. And this gets into some ethical and moral questions that every person has to answer for themselves. And again, you have to decide as a nurse what you believe and what you can do within those beliefs, and where the line is between what you believe and imposing that on others. So some potentially assisted reproductive technologies. First of all, one thing that I did not meant to mention on all of the meds, any medication that stimulates ovulation carries a risk of multiples. It increases the likelihood of multiple gestation. And it may not just be twins or triplets. It can actually lead to higher order multiples. The more babies there are, the more fetuses there are inside that uterus at one time, the higher the risk is. So, and the reason I remembered to bring that up now is because several of these reproductive technologies have the same risk. So let's talk about, there's just some more definitions. Get out your vocab book. Let's talk about some assisted reproductive technologies. And the first thing we're going to do is just go through and list what they are and what they mean. When you hear people talk about IVF, that's in vitro fertilization. That means an ovum is fertilized with sperm in a test tube, petri dish. Okay. And then once an embryo develops, that's transferred to the uterus. That embryo is transferred to the uterus for implantation. So typically, because this is a very time and cost-intensive therapy, typically they want to harvest several ova at the same time, fertilize several ova, and then they select the ones they think are most likely to survive for implantation. So if several embryos develop at once, there's the potential for either very high order multiples or for having to make a decision about what to do with embryos that are not implanted at this time. So IVF was one of the earliest assisted reproductive technologies. It does come with some ethical questions, and people answer those in different ways. Gift is when ovaries and sperm are retrieved, they're placed in a catheter together, and then they're immediately transferred to the fallopian tube. And the idea is that fertilization takes place in the tube. Okay. So I think it's gamete intrafallopian transfer or something like that. They place both the gametes in a fallopian tube and hope they find each other. Zift is when a zygote is placed in the fallopian tube. So then this is similar to in vitro in that the fertilization takes place in a lab setting in the petri dish or the test tube, and then the zygote is transferred before it reaches the embryo stage. So when we get to fetal development, when we talk about zygote and embryo and fetus, zygote is the very first stage when the sperm and the ovum have just combined. Ovum transfer means that a donor ovum is used with any of those technologies rather than the mother's ovum. So sometimes people are able to do these reproductive technologies with their own gametes, their own ova or sperm. Sometimes they require donor sperm because the male partner is not able to produce enough sperm that are viable. Sometimes they require donor ova. Sometimes they require both. Sometimes patients who are able to produce their own gametes will still choose donor gametes because they are concerned about maybe a hereditary condition. Embryo adoption is a newer option. Remember that with the assisted reproductive technology, sometimes more embryos are produced than can safely be implanted, and those embryos are usually kept in cryopreservation. And there are families now that are adopting embryos that have been stored. The embryo is then implanted, usually more than one. And then if the pregnancy is successful, it goes from there. Surrogate parenting is when the female partner is unable to carry a child safely. And so either her ovum or a donor ovum and the partner's sperm are used, or donor sperm, either way, and a surrogate carries that child. Surrogacy has a lot of legal murkiness about it because in most states, the person that gives birth to the baby legally, before surrogacy, the person that gives birth to the baby legally would have been the parent, and so would have to give that baby, relinquish that baby for adoption by the parents. Most states, I don't think, have made a lot of changes to that. And so there's some potential legal issues there with surrogates changing their mind at the last minute. There have been a few legal cases. So surrogacy has some kind of legal and ethical pitfalls there. More, to my knowledge, people are more likely now to use family members or to ask family members to surrogate for them. Therapeutic insemination is when either the partner's semen or donor semen is introduced into the uterus after ovulation is triggered. So they would use some meds, trigger ovulation, and then insert the semen directly into the uterus in the hopes that it would find some of those, one of those ova in the fallopian tubes. Intracytoplasmic sperm injection is when the sperm cell is directly injected into the ovum. And then if it develops into an embryo, then it's implanted just like in IVF. Assisted embryo hatching, the zona pellucida of an ovum is penetrated to increase the chance of implantation. So that would be used with like IVF or intracytoplasmic sperm injection. Pre-implantation genetic diagnosis is an ethical dilemma that has arisen. Now we have the ability to allow embryos to develop in a lab before they're implanted. We also have the ability to test those embryos for some specific genetic disorders. And so sometimes families with a family history of cystic fibrosis or sickle cell or Huntington's disease might actually have those embryos tested so that they're implanting embryos that do not carry the gene for those genetic illnesses. And that obviously brings up some ethical and moral questions. There are a lot of the ethical, legal, moral questions that come up around assisted reproductive technology have to do with beliefs about when human life begins. For someone who believes that human life begins when the sperm penetrates the egg, okay, at the moment of fertilization, that's going to impact how they see the ethical decisions that come down the line after when you're using these reproductive technologies. For someone who believes that human life begins at a later point, they may have difficulty understanding why another person is opposed to their choices. So there's a lot of conversation, but not always a lot of resolution about that. It's very common with IVF for several embryos to actually be ready to implant at the same time. And all of these procedures are very expensive, they're invasive, they're time consuming. And so families frequently will want to implant more than one because they're afraid if we only implant one, we lose that one. We have to do it over and over and over again. In the past, many higher order multiples have actually been gestated this way. I think the record might be 9, but those are happening through IVF. So what happens when a provider has implanted 8, 7, 8, 9 embryos into a uterus, it's unlikely that all of them can survive. And it's also very possible that because there are so many, they'll all be lost. So there's a question about how many embryos should be implanted, or if we're using ovulatory meds and we have quadruplets, quintuplets, that can endanger the entire pregnancy so that all of them could potentially be lost. So there's some ethical and moral questions about whether therapeutic reduction should be used. Therapeutic reduction is when higher order multiples have implanted and some of them are removed in order to make it more likely for the rest to survive. There also are questions about what happens to embryos that are not implanted. Should they be preserved or should they be wasted? There are questions about surrogate rights. Does a surrogate have the right to change their mind at birth and say, no, I carry this child, I want to raise this child? There are questions about donor rights. If someone donates semen or eggs, do they have any rights to those to the children? There are ethical questions about the expense and putting the amount of money that is spent into having biological children. So there's a lot of ethical, moral, legal stuff surrounding this. How do we handle that as a nurse? Once again, and I'm going to say this about 1 million times this semester, you have to figure out what you believe, and then you have to be able to separate living by what you believe from forcing that on other people. There are risks. Many assisted reproductive technologies require stimulation of ovulation, which is involves lots and lots of injections, first of all, but also there's some side effects with all those meds. There's a lot of the women undergoing this feel pretty miserable. Multiple gestation, including higher order multiples, is more common. And not only is that a greater risk of miscarriage for all of the embryos, but that increases the risk of the pregnancy to the mother. Ectopic pregnancies are more common. That means a pregnancy that's not in the uterus, somewhere else. And with all the invasive procedures, there's some risk of infection. As a nurse, your role is to provide accurate information and emotional support. Grief is common in families that are struggling with fertility, and family difficulties, relationship difficulties are common because people grieve differently and are not always available to support each other. Some families choose to adopt by preference. Some families choose to adopt without attempting conception. Some people plan their families from the beginning to be adopted. There also are some ethical and legal questions sometimes about adoption. There have been cases in which children were basically trafficked for adoption. So their families did not necessarily know they were relinquishing rights to those children, and then the children were adopted by someone. Commonly, those are foreign adoptions. So the whole area surrounding family planning has a lot of ethical and moral things that we need to address. Okay, so that's all about infertility. We're going to come back and talk about not getting pregnant next.